The green tape signifies areas of high mobility. And so these are the joints like the ankle and the hip and the shoulder, and then the mid-back, the thoracic spine. These are areas that have to move a lot. And these are the areas that need to move. What happens is when these areas don't move and they lose their mobility, then the other joints have to compensate. And so we start to get wear and tear and compensations and poor movement in other joints in other areas of our spine. And then when we deal with the hips, we start to see areas in the knees that break down and also in the lower back. So the hip really relates a lot to that lower back pelvis and also down into the knee. When we talk about the hip, there's a couple components that we talk about. Right here is your leg bone that attaches into your pelvis. And so your pelvis here is the base for where your spine sits in between. This is your iliums. These big bones here are called your iliums. This is your sacrum bone. And then your vertebrae and your spinal column lines up on top of the sacrum bone here, which is protected by your iliums. And then the iliums come down in front, and so that it creates this cradle. And then your hips actually go into your iliums here on the side. And so your hips have a large range of motion. They move in all the directions, front, back, side to side. And so whatever muscles that are coming up through the hips into the pelvis also go into the lower back.